Hello again, everyone, and welcome back. My name is Tom Nelson, and this is a continuation of the Diabetes Control course. This is step number 5 of the 6 steps to gaining complete control over diabetes. It's on diabetic weight loss. This is video lesson number 11, part 1, all about fat. Your blood contains 3 primary types of fat, or lipids as scientists call them: high-density lipoprotein, which is HDL, low-density lipoprotein, which is LDL, and triglycerides. Your tissues have 2 primary forms of fat as well. Visceral fat and adipose fat are both major role players in your health, and those are the ones you're going to be focusing on to try to minimize. There are many factors that influence where you gain fat, like genetics, hormones, age, and possibly even due to your birth weight. Visceral fat lies in the spaces between the abdominal organs and the apron of tissue called the omentum. You see in this diagram, right in this area, all around all of your organs, you will find the visceral fat. The subcutaneous fat is located between the skin and the outer part of the abdominal wall. That abdominal wall is where your abdominal muscles are found. So smaller babies may be destined to gain more belly fat later in life. Several genes may be associated with an increased level of abdominal fat. As people age, they become less active, so they lose muscle mass, which increases the risk of obesity and the manifestation of diseases, dysfunction, and disorders. It significantly increases your risk of gaining that visceral fat, which is so problematic. Postmenopausal women store more visceral fat due to changes in their hormones. Most notably, the decrease in estrogens are what really cause the issues. Diet and lifestyle are also risk factors. High carbohydrate, high glycemic index diets almost guarantee that you will gain more visceral fat. A sedentary lifestyle significantly increases the risk of being overweight and having higher levels of visceral fat. Drinking too much alcohol will cause a significant increase in visceral fat in both men and women. It also increases your LDL cholesterol. Trans fats are preferentially stored as visceral fat, so obviously you should eliminate those from your diet. So that is why visceral fat contains large amounts of trans fatty acids, and why trans fat intake is found universally in the abdominal fat. So the best way to gain visceral fat is getting little exercise, eating too much food, eating the wrong kinds of foods, eating processed foods, fast foods, junk foods, high glycemic index foods, all that contain trans fats, and drinking alcohol regularly is all but a guarantee that you're going to gain visceral fat. So the good news is, however, is losing visceral fat and keeping it off really is not all that difficult. Again, your blood contains those 3 primary types of lipids or fats: the HDL, the LDL, and the triglycerides. Your tissues have 2 primary forms of fat tissue, visceral fat and adipose fat, both major role players in your health, and they should be minimized. We're going to look at each of these tissue fats in depth: what they are, where they're found, where they come from, and how to get rid of that excess fat. So now go to video lesson 11, step 5, part 2, how your body manages fat. Thank you for watching, and please pay it forward.